everyone. Thank you for having me and Brian today. My name is Merela Ghazal and I'm the Executive Research Manager for the Sydney Local Health District, a HREC member of the Royal Prince Alfred Hospital Committee and a member of the Executive of the Ethics Committee. But really, I am a systems person, an operations manager who prefers to be in the background, not talking, but listening and operationalising ideas. I'm going to keep this presentation very short as we have an incredible panel coming up who are have far more interesting things to say than me. I'm also joined by the incredible Brian Dalton, who is going to discuss one of the initiatives that he was part of. I'm just coming to you from Gadigal land, from the great Eora Nation, and I pay my respects to elders past and present. This map was developed by our Aboriginal health staff. I just want to say congratulations and thank you to Gordon and the lovely Sophie and the organising team for a hugely successful conference. I am proud to be part of this community. I have been in research, ethics and governance and facilitation for over 13 years, and I have to say I'm still learning every single day. I just want to thank Gordon and David Cook for honouring our colleague and my chairperson, Dr. Robert Lovelay. His passing has been a great loss for us. I feel so lucky to have worked with Rob over the past 7+ years. He was inspiring and passionate about fostering a culture of high ethical standards, whilst encouraging novel and exciting research ideas. Because of Rob's leadership, the HREC actually had a reputation for being an enlightened HREC, and researchers knew they could really submit any types of application to us, and we would seriously consider them. I miss Rob very much, and I hope his work and legacy will live on always. So I wanted to share with you in the next few minutes how we managed to introduce a proforma for consumer engagement and how we embedded this across the institution and made this a core criteria for ethics applications. I want to preface this by saying that none of the information I'm going to present is new, and you've probably heard all this before. However, for us, we knew that it was time to make this a priority for the HREC. So this particular slide, the groundwork was already being laid back in 2012, the SLHD had actually developed the first ever research strategic plan, and consumer engagement was a priority area. I was very excited about this prospect, and during my interview in 2013, I queried how this was being implemented across the district. The district was setting up board level committees to reflect their commitment to a patient and family-centred care health service. It was an exciting time, and across the state and country as well, there was also growing focus on this area, and research was being included in these discussions. In 2013 and 14, when the organisation achieved the NHMRC Advanced Health Research Translation Centre status, with the formation of Sydney Health Partners, and with the Australian Clinical Trial Alliance gaining presence, there was real collaborative efforts began bringing more clinical trial specific resources to the sector. And as you know, in 2016, the NHMRC released their guidelines. And obviously, as we all know, in 2020, the Safety Commission released the draft Clinical Trials Governance Framework document. And our district was chosen as a pilot site. In 2021, we underwent assessment. Despite the richness of the resources out there, challenges still remained in convincing our own research workforce at the coalface to adapt and embed consumer engagement for every research study or program. Really, there was no shortage of ideas. I mean, it was incredible. It was inspiring of the work that's been done. But it was clear that consumer engagement had to be a key component of research design and output. I think the turning point happened for us in 2021 when we were selected as a pilot site for the National Clinical Trials Governance Framework. The LHD had done very well and had actually achieved the highest rating of established system. And as I mentioned earlier, we had already implemented board level committees for consumer engagement. However, the pilot program really highlighted to us that consumer engagement was probably still lacking at the coalface and for every research study. So with all the groundwork being laid, we felt that if we didn't act or do something to respond to all the richness of the resources out there, despite the pandemic and the pressures on the health system, and play our part to strengthen the consumer voice, then we were going to miss a great opportunity. The HREC governance system is a key part of the research ecosystem, and it really was identified. It was identified as a potential lever for change. I just want to pause here and say I'm really sorry for the bad pictures. As you can see, I don't give many presentations, and I still haven't worked out how AI can help me with this space. Anyway, as you can see, we really drew a line in the sand in 2021. We leveraged off the work that had already been done in the space, and we set sail. It really did feel like we were sailing alone in a big ocean. So we developed a post-pilot action plan. We had it endorsed and approved by our executive and governing bodies and our steering committees. And we proceeded to introduce a simple one-page pro forma with instructions. We distilled as much information onto the pro forma, noting that we didn't create anything new. We just used what was already out there, and we just simplified it in a form. I mean, the form was not really difficult to develop, but it was the communication, which I think is a real superpower, the change management, and convincing every one of our researchers who will submit an ethics application the value in doing this. We introduced the form very slowly, gave our researchers 12 months to think about a plan of how they would embed consumer engagement into their specific study, department, or research program. We were very much open to all ideas, we were flexible, but we just wanted to see some effort in this space. After 12 months, we started requesting a copy of the plan, and then each year after that, we requested an update on the progress being made at the time of the annual progress report was due. These plans were added to our HREC agenda and part of the committee's paperwork. To support the rollout, we carried out several training sessions. We added resources to our websites and intranet pages. We really discouraged researchers from starting a consumer committee and just really highlighted the ways in which they were probably already engaging consumers in research. I guess we just wanted them to start somewhere, and we wanted them to start small. We captured every response submitted on the consumer plans, and we evaluated the information regularly, and then we kept updating the pro formas and our training programs accordingly, and highlighting examples and ways in which researchers were doing this really well. Once researchers knew others were actually doing it and could grasp that it wasn't hard to implement, that it was not going to take up any extra time and resourcing, most of them came on board. Sometimes we did throw in some big names during the training programs to highlight what others were doing in the district, which fueled researchers' natural competitiveness to take action. In 2022, we went and onwards, we took it a few steps further. We made it both a condition of ethics and governance approval. We developed a pro forma for the SSA where we were not the lead HREC. We updated sections in our protocol pro formas with partnering and consumers detailed really in the first sections of the form, really just to kind of emphasize our commitment to this space. And then finally, we institutionalized it by updating the research governance policy. Protocol templates have now been updated for all studies, not just clinical trials, and it is now an item on the new applications checklist. Yes, we did receive complaints and resistance, and I was told at one point that I was misunderstanding the standards of the National Clinical Trials Governance Framework. But for me, I guess the complaints were minimal, and they were coming from the same group of people. We actually thought we would have a hard time with the commercial sponsors. However, they surprised us, and many of the commercial sponsors and pharma had actually submitted or detailed fantastic examples of consumer engagement. And we used those types of examples in our training programs. I think by the end of 2023, almost every clinical trial study in the SLHD had a consumer engagement plan. Again, back to the pictures, but I guess we really started seeing quality and our expectations exceeded when, and I'm not sure, I know that some of the granting bodies had been doing this for a long time and mandating consumer engagement and considerations in their applications. I'm just not sure what happened in probably like from 2022, 23, but all of a sudden we were seeing consumer engagement initiatives embedded in ways I never thought I'd see in my wildest dreams. And let me tell you, you need to have wild dreams to work in this sector. So I guess with thanks to the grant bodies who actually mandated this for grant applications, we were actually starting to see some impressive work in this space, such as consumers as investigators, consumers as CPIs, leading projects, first authors on papers, consumers leading the training at relevant research forums and advisory panels. It was truly impressive. And as I mentioned, the organisation already had district-wide systems for consumer engagement, but we really felt we could strengthen this by ensuring it was occurring at the research level. I think the ultimate validation that this had all been worth it, despite the complaints, came actually last month when the LHD underwent the short notice assessment for the National Clinical Trials Governance Framework, where a sample of the district's 705 clinical trials were assessed. The assessor actually in the summation meeting commended the Sydney Local Health District for having actual high levels of consumer engagement. So all had been worth it. So I just want to finish off by saying to anyone that are running committees, you can start small. You can encourage a stepwise approach, evaluate the progress. You just really keep it simple. You really aren't starting from zero. There's so many great resources out there. I'm already inspired even in the last half an hour of all the great stuff that's already been done. But I could also challenge you to say, go big. Why not? And I just want to say thank you to all the organisations, all the consumers who advocated and pioneered this space, because you really made this space so simple for us. And I would have to say you're very welcome to use our proformas. Just send me an email and I'm very happy to share them with you. I'm just now going to pass on to Brian, who have actually been so instrumental in championing consumer engagement and research in our HREC. And has always been, Merela, send me an email, when are we going to start doing this? When are we going to start doing that? So thank you, Brian, and over to you.
Well, I can only second everything that Merela has said. I've been part of the ethics group now for 8 years, and this is the latest, one of the latest evolutions in perhaps my scope as a lay member of the ethics committee. But Merela is right. I have been a voice, as have my colleagues, on how are we going to adopt this into both reviewing clinical trials, but also non-clinical trials that come through the ethics committee, and all around reflecting the expectations of the participants, which is our role, or our broader role, but my specific role, to be custodians for those participants, and how best are they going to participate. But we've always come from the premise that this will only enrich the study and make it a far more robust study, which is fostering excellence and integrity and quality and highly relevant results. That's always been our premise.